All right, it's that time of the week, time for our weekly check-in with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, good to see you this morning. So here we are, December's arrived. That means the holidays, but also flu season as well, and cases are climbing. So at the same time, people are going to be gathering in groups for parties and celebrations. There remains a lot of talk, too, about the effectiveness of this year's vaccine. So where are you right now when it comes to the flu?
Yeah, we're going to have a big flu season this year. It stinks, but that's just what's going to happen. We know that because there's lots of metrics pointing in that direction. We can see from the Southern Hemisphere, Australia had a bad one, and that's an imperfect but reasonable metric. We can tell that it's an H3N2 dominant flu season. There's several different types of flu, but we know on average when we see more H3N2 at a population level, it's a bit of a tougher flu season. And to your point, when we look at the vaccine this year, the vaccine still provides some protection, but it doesn't provide as much protection as we would like for that one component. Let's remember, the flu isn't just one virus. It's three viruses that are circulating. The vaccine provides protection against all three of those strains of flu that are circulating. One of those three strains circulating, the vaccine provides a little bit less protection than we would like, but it still provides some protection. The take-home message is the vaccine is still very helpful. People should be going out and getting it because the flu is, it's not a mild sniffle. It's a nasty virus, and it can be very, very significant, especially in young kids, pregnant women, older adults, people with underlying medical conditions, and nobody wants to get the flu.
Yeah, that's for sure. Okay, here's an interesting one that I found, Dr. Bogoch. I thought this was curious. You remember during the pandemic, you remember this very well, of course, people were getting kind of selective about which COVID vaccine they took. Now the Pfizer vaccine, apparently a little more difficult to find in Ontario, while Moderna's is generally widely available. So are there many differences between the vaccines that really make it worth holding out for like one over another?
No, not really. I mean, I think any differences would be minuscule, but essentially they all do the same thing. Remember, when we're talking about COVID vaccines, the National Advisory Committee on Immunizations has recommendations. There's the should be vaccinated category. That's people over the age of 65 in long-term care facilities and with health conditions that put them at greater risk for severe infection. And then there's the may be vaccinated category. That's everybody else. So people who should be vaccinated, again, it's a very good idea to go and get those vaccines because there's a risk for severe infection, and it doesn't really matter if it's what brand of vaccine they're getting.
Okay, that's good to know. Dr. Bogoch, last question here. Yesterday, we marked World AIDS Day. We had a conversation with CanFAR, highlighting that many people are living with HIV and living long lives, but that's also having an impact as these people age and have other medical needs. So what more can be done to help people living with the disease while also dealing with the specific medical needs unique to that community?
I'm so glad you raised that point. I mean, that's the key message is people are living with HIV. They're not dying from HIV. If you were lucky enough to live in Canada and we have access to care, people can live a long, healthy, happy, normal life with a normal life expectancy. Okay, and they die at the same age as other Canadians who are not living with HIV of the same conditions, cardiovascular disease, dementia, etc. So really the key here is primary care. Right? People need a family physician to help with age-appropriate cancer screening, to ensure they're up to date on their vaccinations that seniors would get. And people just need good routine family medicine, senior care. In Ontario, there's obviously this huge push to ensure that everyone has access to a family physician. And I think that's going to be very helpful in the years ahead, especially for those living with HIV, because they are living with the infection. One other key point, I know we're out of time, but it's really important for people to know that this is a completely different infection in this era than it was in the 80s and 90s, right? One pill once a day, and people who have what we call suppressed viral load, they can't transmit the virus to other people, and they will live a long, healthy, happy, normal life with a normal life expectancy. It's fantastic. We've come so far. Yeah,
pretty remarkable in our lifetime. I remember when, it was all hitting initially, and it was like death sentence, but now so much different. Yeah, it's pretty amazing. Dr. Bogoch, we always appreciate the time. Thanks so much. We'll see you next week.
Thank you, Nick.